This is Dr. Boden with the Hair Restoration Center of Connecticut, and I want to introduce you to a patient of mine named Katrina. Katrina is a woman who's 60. She came to see me because of significant concern about hair loss, particularly in the front, and she started to develop an angular recession, and she said it resembled her father's hairline. Bothered her very much. Our patient had approximately 2,000 follicles, really to strengthen the corners and the front as well as up to, through the middle of the central area here. The procedure she chose was a linear extraction, or FUT procedure. She's never intending to do a buzz cut, and the procedure went very well. The hair loss really was frontal. You had a lot of loss, and it became a really angular pattern, like a, if you will, male pattern. And so what we did was soften this, and let me come around you behind you here for a second. On both sides, instead of having this angular pattern, which we can look at in the pictures in a second, this is all transplanted hair now. So if we look closely at the transplant, the real goal of transplantation for everybody is to create a natural appearance.
Yep.
And specifically, when we do hair transplant in women, and that women constitute about 30% of my surgical practice, when we do hair transplant in women, we try to create a soft, feminized, rounder hairline. And so that's really what I want to show others here. So if you look closely, this is all transplanted hair. We brought the hairline down slightly in the center, but this whole angular recession here is now constituted by transplanted hair. It's a very gratifying part of my job when I see people come back and express how they're doing and ultimately how hair transplant has affected them in a positive way. And the paradox is that they don't think about their hair transplant. The people they encounter don't say, "Great hair transplant." They just say, "You're looking good," or there's a certain air of confidence about you.
After the hair had come back in, it was just fantastic because I could, again, put my hair back, use a hair clip, what do you call it, a headband, and not, I was always embarrassed before I had this done. I couldn't, if the wind blew, I was embarrassed. Now it doesn't matter, and it just made a huge difference in my self-confidence.
To me, this is a tremendous feeling of that I've made the right career decision, that I can help people come to feel better about themselves.